Good afternoon, and thank you for taking the time to hear us talk today about a very important topic that every doctor in the United States should be very concerned about. I'm Jim Merlino. I am a colorectal surgeon who practices at the Cleveland Clinic Health System located in Cleveland, Ohio, and I'm also the Chief Experience Officer for the organization who is responsible for not only patient satisfaction but also referring physician relations. Patient experience is a topic that every doctor in the United States needs to understand how it is important to what they do every day to take care of patients. Today I want to talk to you about our current practice environment as it affects physicians in the United States. I want to define a little bit about what makes up the patient experience, review value-based purchasing, and I hope to help you understand the importance of physician communication and how that plays in improving the patient experience for your patients. We are entering an era of increasing transparency. You only need to look on the internet to see the wide variety of information that's available about anything out there in our society. Increasingly, we are seeing more information that is available on how doctors and hospitals practice. We're seeing safety outcomes, quality outcomes, and we're also starting to see patient satisfaction outcomes. You can see this in a variety of areas, but the best place to look recently is in Massachusetts. Consumer Reports recently partnered with the Massachusetts Department of Public Health to produce very specific doctor and practice specific outcomes information, which includes seeing how individual practices drive access, drive safety, drive quality, drive patient satisfaction. The increasing availability of public metrics in a wide variety of areas and how it affects healthcare and healthcare delivery is something that organizations across the country are starting to use to drive increasing transparency as they push towards better quality and better improvement. We are currently in an era now where payments of the future for medical services will be reported and increasingly tied to quality outcomes. In the past, what we've seen is a lot of accountability around organizations, healthcare organizations, and hospitals. But we are rapidly moving to an environment where individual providers, physicians, us, are being held increasingly accountable for our actions. And it's the use of transparent information that's widely available or becoming more available that is a tool that regulatory bodies, providers are using to drive improvement. So increasingly, us as providers and individual practicing physicians are becoming more accountable to the way we practice. If you look at the external practice pressures currently on all physicians in the United States, what you see is Medicare, the states, and private payers paying increasing attention to physician outcomes. Additionally, the Joint Commission, Medicare, and also regulatory bodies in the states are starting to look very closely at physician complaints. Many states now have anonymous hotlines for patients to call to report dissatisfaction with medical services for hospitals, and increasingly those hotlines include information to report complaints about physicians. There's also an increasing look at satisfaction as an outcome. Medicare is currently using this as part of their Pay for Performance initiative. Some states, as I mentioned Massachusetts, but also payers are increasingly using satisfaction metrics to drive reimbursement formulas. Also, something that all physicians have to be accountable to now is their behavior. The things that we did in the OR 10 years ago are no longer acceptable. They were not really acceptable then, but now regulatory bodies like the Joint Commission, regulatory agencies in states, and also Medicare are starting to monitor individual physician behavior. And they're not only holding hospitals accountable, but they're increasingly looking at holding individuals accountable. Also, I don't think I have to talk about why patients sue. There's no question that when you look at things linked to patient experience, like communication, it's one of the most important reasons why patients and their families file lawsuits. Often it's because patients are angry or their families are angry, or people get into fights with other caregivers, either orally or in the chart. And all of these things are discoverable, and these lead increasingly to how lawsuits are driven in our society. Additionally, inaccurate communication around patients and families also drives lawsuits. It's very interesting because when you look at the evidence, very highly technical physicians are able to deliver a superb outcome. But if they have a complication related to that outcome and they don't communicate it well, they are at risk for a lawsuit more than the physician who is technically inadequate or less facile with their procedure than if they communicate well. They're less likely to be sued. So we have to understand not only the environment that's changing around us, but how our actions around communication impact whether or not we face litigation. This looks at a timeline of how things that were held accountable today have been used in the past. And you can see that a lot of the metrics around safety, quality, even patient satisfaction have been used for internal performance improvement metrics. They've been picked up also by accreditation agencies like JCAHO. CMS has used it for their pay-for-reporting process, and now it's part of their pay-for-performance process that all hospitals in the United States that accept Medicare dollars are going to have to be accountable to. The government's goal with satisfaction and other metrics is really to look at topics that are important to consumers. They believe that you can increase accountability through transparency, and they think that transparency by using public reporting is an incentive for hospitals and providers to improve quality. These three goals, as I've listed them on the slide, come right off the CMS website as it relates to their HCAPS patient satisfaction process. I think everyone in the audience understands what the big four buckets are that the government's interested in. It's core measure process outcomes around specific diagnosis, it's satisfaction in a variety of areas, it's outcomes around certain DRGs for death and readmission, and it's also a variety of safety indicators. These generally are the big four buckets that CMS is looking at, but they're increasingly looking at additional metrics to hold hospitals and individual providers accountable for. So when you think about who's watching our outcomes, not only as a hospital, but as an individual provider, whether you're in private practice or you're working for a large group or you're employed by a company, accreditation organizations are looking at individual physician outcomes. Consumers, because of the wide availability of this information on the World Wide Web, are able to see this now and use it in making healthcare decisions. Administrations use it because obviously it's a marker of quality as it reflects their organization or their institution. Your partners are following these outcomes. Payers are following these outcomes. When you look at the history of using outcome metrics, nobody uses this information better than payers. And what you'd be surprised to learn is a lot of the large payer organizations have more extensive databases and more information on individual providers than the government does. Private organizations use it for rating. Businesses are using it as part of contract negotiations because they want to know that they're sending their employees to reputable organizations that are able to drive high value, good outcomes for their employee patients. And as I've mentioned, CMS and the states are increasingly using information and they're watching what we're doing. So what is the patient experience and why is it important? This is a study that was done by McKinsey in 2007. And what they did was they interviewed 2,000 patients and asked them what influences their choice of hospitals. And as you can see, 41% chose issues related to the patient experience. And when they drilled down on those 2,000 patients and asked them, what do you mean? These are the types of things that they identified. It's being informed, on-time appointments, room appearance, simple access, better scheduling, better food, value for their money, billing concerns, staff responsiveness, being involved in their decisions, emotional support, spiritual support, supportive and healing environment, convenience and comfort of common areas. These are things that patients see as their quality. It's a typical mismatch that providers and hospitals believe that patients are only concerned about quality, that also providers are watching. But it's absolutely not true. The majority of patients in the United States and across the world today hold on to things that they can understand. They often view quality in terms of things that they know, not in terms of things that are important to us. And managing that mismatch, understanding what's important to the patient, is critical to driving a good patient experience. Often, patients will view performance failures in these areas as a definition of the quality around your care. We see this a lot. It's been validated in surveys. It's been validated when we look closely at patient verbatims. They will view miscommunication on the floor as bad medical outcomes, despite the fact that their care may have been perfect or your procedures might have gone without any complications. So it's very important to understand that this is what's important to patients. It's interesting because I tried to define this when I first took this role 3 years ago for the Cleveland Clinic Health System. And I asked myself, how do you define the patient experience? But more importantly, how do you drive improvement strategies around it? What are the important issues to consider? I had one of my patients who was staying in the hospital keep a journal of everyone that contacted her. So this was a 43-year-old woman who came into the hospital for the treatment of rectal cancer. She stayed 5 days after her surgery and had no complications. There were 8 different staff physicians that participated in her care, 18 different departments, 60 nurses. There were 60 different nurses' names in that journal, and so many other people, including residents, fellows, housekeepers, meal delivery people, PSRs, nutritionists, that participated in her care, that one day I walked into her room and she said, "I'm sorry, Dr. Merlino, I forgot to have 3 people sign my journal last night." And what this said to me is that delivering a great patient experience really takes teamwork. It takes alignment around everybody that's touching the patient so that they understand that their role in patient care is just as important in my role. Because what you'll find is patients will remember the bad experience. As I talked previously from the McKinsey study, it shows that patients hold on to things that are important to them, that they can understand. They leverage those things to really make their understanding of the care delivery process something they know. And so when you think about everyone that's involved in making sure that those patient-specific quality metrics are together, it requires alignment of everyone that you work with to deliver not only high-quality, safe care, but ensure that that patient experience is met as well. And when you think about what areas of the hospital and who the family and friends talk to, they are also important drivers of patients' perceptions of how their care was delivered and ultimately whether they're satisfied in their experience. The way we've driven this to our organization and to our physicians is to think about the care journey as a longitudinal metric. Don't think about it as just your 5 minutes with the patient and what you did for them. Think about how everything is connected. Think about what they thought of us and you before they came into the system. What was impacted around their care while they were with you, whether in the hospital environment or whether in the inpatient environment, and how did we work together to get them back to their normal state of being? Managing that 360 and delivering great, safe medical outcomes is the responsibility of every healthcare organization, but more importantly, it's your responsibility as well, because when you see disconnection in that journey from patients, that's what they complain about. And again, it's important to understand that that is their quality. That's how they define whether or not things went well. So for instance, you can have a perfect experience around the care delivery of an operation. They could have a great postoperative course, but if the discharge instructions around medications or follow-up aren't communicated clearly, they leave the hospital, they become anxious, they get a little insecure, and suddenly their definition, their perception of the experience in the hospital is clouded by what happened in the discharge process or what didn't happen. So it's important to understand that our responsibility is to not only manage the care around the event, but it's to understand that events occur on a longitudinal platform, and we have to be thinking about how things are connected together so that patients understand smooth transitions.